China's breakthroughs are revealing a growing ambition to rival industry leaders like Elon Musk's Neuralink.
China's rapid leap in brain technology rivals Western innovation. A groundbreaking medical demonstration recently captured global attention from a hospital in Beijing, where a 67-year-old woman suffering from advanced ALS was able to express her thoughts on a computer screen without speaking a single word. The translated phrase, "I want to eat," was generated directly from her brain signals through a pioneering implant known as Beina-1, a wireless brain-computer interface developed in China. This moment, part of a clinical trial involving 5 patients, underscores how quickly China is narrowing the technological gap in the field of neural interfaces, an area once dominated by American firms. The Beina-1 chip, comparable in function to similar technologies developed in the United States, was designed and tested by a team at the Institute for Brain Research in Beijing. The institute's director and chief scientist behind the trial confirmed that the system is demonstrating high accuracy in translating brain activity into digital communication and mechanical commands. Feedback from patients has been overwhelmingly positive, with many expressing a renewed sense of control over their bodies, something that had been lost due to neurodegenerative conditions. Encouraged by the results, the team now plans to significantly scale up their trials, targeting 50 to 100 new participants over the next year. The Beina-1 device has now been implanted in 5 patients, matching the number of human trials conducted by major U.S. players in the field. One such company, based in California, also began human trials recently, while another firm, backed by prominent global investors, has reached 10 patients across the U.S. and Australia. While China entered the brain tech arena later than Western nations, its progress has been striking. A neuroscience professor at a prestigious American university commented that China's advancements are not only closing the gap, but in some areas beginning to push the boundaries of the field. Researchers in both nations appear to recognize the immense medical and commercial potential of this technology. According to market forecasts, the global brain-computer interface industry, valued at over $2.6 billion last year, could soar to more than $12 billion by the next decade. But for China and the United States alike, the race is about far more than profit. It's about scientific leadership, national security, and the future of human-machine integration. In Beijing, the government-backed institute developing Beina-1 was established in 2018 and later spun off a private startup to commercialize the technology. That startup is now spearheading clinical applications with increasing urgency. The woman at the center of the trial, previously unable to communicate, can now form short sentences using her thoughts alone. Her case marks a significant step forward for patients with ALS and other disorders that impair speech and movement.
Unlike some Western systems that require invasive surgery to implant devices deep within the brain, the Chinese team has opted for a semi-invasive approach that avoids penetrating the brain's protective outer layers. Despite this, their results remain promising, offering safer procedures with fewer complications. This third clinical trial marks the latest milestone in what developers describe as the world's first batch of semi-invasive wireless brain implants in human subjects. 2 additional procedures have been performed since, bringing the total number of participants to 5. The strategic intent behind this push is clear. As global tensions rise, particularly between the U.S. and China, technological breakthroughs are becoming key battlegrounds in a broader contest for influence. In his public addresses, China's top leadership has emphasized the importance of technology in national development, describing the sector as both a frontline and a competitive arena in international affairs. This new ambition reflects in state policy. China's government has been steadily increasing support for neuroscience and artificial intelligence over the past decade. From high-level investments in brain science initiatives to ethical oversight on human trials, the infrastructure for innovation is expanding rapidly. China's focus on brain technology began in earnest during the 1990s. By 2014, a national program was under discussion. 2 years later, brain-computer interface research was officially listed as a priority in China's 5-year development roadmap. Since then, local and national bodies have allocated significant resources to research institutions, startups, and clinical testing. Former research staff from leading Chinese neuroscience labs report that financial support and institutional backing have grown exponentially in the last 5 years. As of last year, the Chinese government introduced its first formal guidelines on ethical practices in brain research. Municipal governments in Beijing, Shanghai, and other innovation hubs are now offering incentives to brain tech companies, streamlining the transition from laboratory to real-world use. Recent academic studies from global institutions confirm China's progress. Non-invasive systems being developed in China are now considered on par with those from the most technologically advanced countries. While historically behind in invasive techniques, Chinese researchers are rapidly bridging that gap, with some systems now meeting global benchmarks. Experts say the technical distinctions between the systems developed in China and the West go beyond mere hardware. The Beina 1 chip, for example, captures brain signals from a wider region but with slightly less granularity at the neuron level. It transmits data differently, and its implant location differs from other leading models.
Comparing it directly with any single Western system, experts argue, may not be entirely fair. Each is designed to serve specific use cases. One focuses on restoring speech, another on motor control, a third on cursor movement. The ultimate goal in all cases, however, is restoring agency to individuals who have lost the ability to move or communicate. Despite differences in strategy and design, one thing is certain: the braintech race is no longer dominated by a single nation. China is now not just participating, but influencing the direction of the entire field. The implications are vast. Beyond restoring lost abilities, brain-computer interfaces could eventually unlock new modes of communication, enable direct mental control over machines, and revolutionize treatment for disorders ranging from Parkinson's to PTSD. As more clinical trials unfold, both ethical oversight and technical excellence will be essential. Global standards may emerge, but geopolitical competition will likely shape how and where this life-altering technology is adopted. In the meantime, for patients like the woman in Beijing who can now express a simple wish to eat, the science is already life-changing. And for the world watching closely, China's rise in brain technology marks a profound shift in the balance of scientific power. Stay with us for continuing coverage on this story and more breakthroughs at the frontier of neuroscience and innovation.